Pedigree analysis in the healthcare system. This is Module 1, Lecture 7 in the genetic series. So the objective of this lecture is to understand pedigree symbols, to understand the purpose of the 3-generation pedigree analysis in the family history of inheritance patterns, and to recognize autosomal recessive, autosomal dominant, X-linked inheritance using pedigree analysis. So we're first going to go through some basics on symbols. A square is a male, a circle is a female. If the gender is unspecified, we use a triangle. If it's a pregnancy, we put a P in the middle. A spontaneous pregnancy loss is a triangle. Sorry, this is a diamond. And if there's a line through it, that means a termination of pregnancy. From a genetics perspective, I don't really care if somebody had a termination of pregnancy. That doesn't mean anything to me. But if they had 3 or 4 spontaneous pregnancy losses, there might be a problem. A darkened circular square means they're affected. A dot in the middle means carrier. And if they're deceased, we put a line through them. So here's an individual. They have no children. Here's a couple. They have no children. But that's by choice. If they've been trying to get pregnant, we put a double line. So that means infertility. One of the most important things in constructing a family history is to put an arrow by the person that we're interested in. Sometimes there's a number of family members, how many brothers and sisters do you have, and they'll say I have 5 brothers and 3 sisters. And if none of them have problems, I might just put a circle with a 4 and a square with a 5. Sometimes I will note ones with specific abnormalities separately. And if they don't know, or if the wife doesn't know how many brothers and sisters her husband has, we'll just put an N. So again, if a couple is married, we put a line. If their first cousins are greater, they get a double line. This is the child of the couple. If there's 2 children, we have a line, and then it separates. Twins, dizygotic twins, they're dizygotic if they're a different sex. If they're the same sex, they could be dizygotic twins. Dizygotic twins, 2 egg, 2 sperm, they could be different sexes, they could be the same sex. Monozygotic twins start with the same egg and sperm, and then they divide at some point. Now, if they at about the 16 cell stage, all the placenta and membranes are made. So if they divide before that, you may have 2 separate placentas, 2 separate sacs. So the fact that they're 2 separate placentas does not mean that they're not identical. But if they are identical, they have a single line through them. If they have a single placenta, then they're definitely identical. And then the next more dangerous state is when the twins are in the same sac, and then conjoined is when it happens really, really late when certain organs have already been determined. And then here we have adopted in, adopted by a relative, woman carrying the pregnancy of a donor egg, so she's pregnant, but the biological is a donor egg or a donor sperm. So these are all the things that we might need to use at sometimes. The biological parents with a surrogate carrying the pregnancy, so the pregnancy is biologically related to them, but being carried by somebody else, and the surrogate is also the egg donor. So rules for construction: male should be put to the left to the female. The oldest goes furthest to the left, with the youngest furthest to the right. And individuals in the same generation should line up horizontally. Information to collect: maternal and paternal ethnicity. German, Irish, African American, Hispanic, because different ethnic groups are at different risk of other things. Are they of Ashkenazi Jewish ancestry? There are a number of inherited disorders that are more common in Ashkenazi population. And consanguinity, is it possible that they're related? Most people laugh, but not all. Information to collect specific to disease: maternal, paternal, relative, like if it was a seizure or a heart problem or whatever, is there anybody else in the family with a specific problem? Cancer. And so even after you complete your pedigree, you ask that separately, because surprisingly, sometimes people didn't understand what you were asking. Age, a diagnosis of some of these disorders, especially when it comes to cancer, and potential risk factors. If like a grandfather had lung cancer, was he a smoker? Information to be collected from again, the types of treatment, how old they were, things like that. And then when we're done with the pedigree, catch-all questions. Anybody in the family with intellectual disabilities, learning disabilities, anybody with 3 or more pregnancy losses, anybody with birth defects. So here's a very large pedigree, but again, you can see the I try to construct 3-generation pedigrees, and each generation is on its own line. We always want to have the arrow on the person. This is a very large, pedigree. So this individual has a cleft lip and palate, and tetralogy, TOF stands for tetralogy of Fallot. She has 2 brothers that are healthy. Her oldest brother has ADHD or attention deficit disorder. Parents are alive and healthy. We like their ages. And here's the ethnic backgrounds. The mom had a sister and a brother, but her brother had a child with cystic fibrosis, so he has a dot in there because he's got to be a carrier, which means it's possible she's a carrier. The maternal grandmother died at 45 of leukemia, and the grandfather is alive. And on the dad's side, his mother had 3 pregnancy losses. Again, this is a red flag. A 28-year-old sister who's currently pregnant. And both of the parents are deceased, and again, you write down what they tell you, old age at 74 or hypertension. And so there is, a family history of learning disabilities, and here we have cystic fibrosis. Here we have another pedigree, and the other thing that we do is we like to put numbers on each generation. So this pedigree does not have an arrow on who our patient is. But here we have adopted, here we have the triangle with the pregnancy loss. This individual is affected with the disorder, and therefore all the siblings are. And here, this individual there's a double line. How are they related? Well, his mother and her mother were siblings. Okay, so that's why you want to look back and how they are related. So first cousins, and then you can, if you go back, you can see generation 2, 4, and 2, 5 are first cousins. 4, 2, and 4, 3 are dizygotic twins. So here's generation 4, 2, and 4, 3 are dizygotic twins. Individuals 1, 1, 1, 2, 1, 3, 1, 4, and 1, 6 are deceased. So 1, 1, 1, 1, 2, 1, 3, 1, 4, and 3, 6 are deceased. Individual 2, 3 is affected with a disorder, so individual 2, 3, and 3, 5 had a spontaneous pregnancy loss, so here's number 5 at 8 weeks. Benefits. It really allows you quick visualization, and with the electronic medical record, it is difficult. We have not yet figured out how to do this in electronic medical records, so we usually write these out and scan them in, but when you're taking the family history, if you ask somebody, did anyone have cancer, and they say no, and then maybe they don't consider colon cancer to be cancer or skin, or they say yes, and then they'll be like, oh, I had skin cancer, It includes both family and social history, and it helps to look at patterns. It gives the full picture, and it's actually the quickest way to do this. So if you get good at this, you'll look very good to your residents and attendings. So how can the pedigree be used? Potential risks for family risk, reproductive risks. It helps to make a diagnosis, aids in determining the proper testing strategies. For instance, if somebody had cancer and they had a relative that had cancer, and then you could say, did they ever have testing? And if we could figure out what it was, that would help. Appropriate medical management and surveillance, patient education, and it really helps them to feel like they're part of the system. So in summary, appropriate pedigree nomenclature is necessary to ensure information is universally interpretable. We recommend getting a 3-generation pedigree. It helps us to obtain all the pertinent medical information, and it's a good tool to really lay out the family history as well as relationships, because sometimes, and this has happened many times, that oh, my dad had cancer, but then when you really take a pedigree, it was really his stepfather. And if it's not biologically related, it doesn't really matter from a genetics perspective. So in generation 2, what is a relationship between 4 and 5? So the relationship I already went through. In generation 4, what is the relationship between 2 and 3? And they are dizygotic twins. In generation 3, what does this dot represent? And that represents that they're a carrier of this disorder. So this concludes this module.